I'm Lisa Mercer, clinical instructor for the PMI Dental Hygiene program in Albuquerque, New Mexico. Today we are going to talk about how to utilize the traditional pano film in a cassette, how to develop it, and also the clinical processes and policies that you need to ensure that you understand before taking a panoramic x-ray. First of all, when taking a panoramic x-ray, you need to get the panoramic box. The box can only be given to you by a clinical instructor. You are required to also contact your clinic rotation. However, they also need to get the box from the clinic instructor. The box will live in the clinic instructor's closet. It's a black box, and in the front it gives you all the instructions to remind you what needs to be done. You also need to get a cassette. We have two cassettes on the clinic. The first one is this yellow one. The second one is our gray one. Once you've obtained a cassette and the clinic box for the pano, you'll then head into the darkroom. Once you're in the darkroom, you need to make sure that you have no smartwatch on, no cell phone, and no light switches on. You have to complete this next step completely in the dark, or you will expose the film. First of all, when you open this box, you will find that there is a blank box of pano film. Inside the pano film, once you open it, there should always be a maximum of 5 pano films in there. The purpose behind this is so that way if somebody inadvertently turns a light on, forgets that their smartwatch is there, all of the film inside the box will not be exposed, only 5 pieces of it. If you find that when you reach in there, there are less than 5 films in there, you need to notify the clinic rotation and or the clinic instructor so they can grab you more film to restock the box that's inside of the pano box. Let's begin. Once we open up this box, you will open it up and you will pull out the dark black sleeve. The dark black sleeve will be folded at the bottom, so you will have to turn it around and open it up. Once you open it up, you will reach inside and you will feel that there is just 5 pieces of film in there. You will grab one piece of film and you will open up your cassette. Once your cassette is open, you will slide the film inside of the cassette as such and then close the film. You want to make sure that you snap it and you hear it snap so it doesn't open. Once you're done with that, you'll reach back over, grab your plastic film, fold it over, make sure that you turn it upside down and reinsert it into the box. Once that's complete, you'll put this box back into the pano box and ensure that the lids are closed on both sides. Now that we're done with the process on how to load the panoramic film into the cassette, let's talk about a few helpful tips. First of all, in the dark, when you've removed this plastic bag and you've reached in to pull out the film, sometimes you might inadvertently find that there is cardboard in there. A normal pano film has 2 pieces of cardboard, one in the front, one in the back, and the film in the middle. These 2 cardboards, according to our PMI Dental Clinic policy, should not be in this bag. However, if you feel that you've reached in there and the cardboard is in there, please remove the cardboard out of the package. Ensure that 5 films are still in the bag and place them back into the package. You do not want to use the cardboard in any way and inadvertently put this into the cassette and then eventually into the developer. If you are unsure of the difference, a few tips that you can do is when you hold the cardboard, you can see that there's no sound. When you hold a film, you can hear the difference. So if you're not sure that something feels different, then make sure that you lift one of the items up and shake it. If you hear that noise, you have film. If you hold it up and there is no noise, you have cardboard. Remember, if you find that the cardboard is in the bag, please make sure you contact a clinic instructor on the floor and alert them of this so that they can go through and do a thorough check to ensure that the contents inside of the pano box do meet the clinic policies. A second tip is to remember that you're doing this completely in the dark. The pano film is very sensitive to light. You cannot have any light on and during the process. So please ensure that you do not have on your smartwatch, iWatch, a cell phone in your pocket, or any kind of electronic device that may inadvertently turn on and emit some kind of light. This will affect the pano film and create an unnecessary need for a retake.